Well, hello, everyone. I'm just going to wait a few minutes just to let people join if they want to watch this as it is live. But today we will be focusing on environmental emergencies. So hypothermia, heat stroke, and heat exhaustion. Okay, I think I'm going to get started now because this is also recorded. So if people want to watch later, they have the option. So, hi everyone, my name is Matilda. Just a bit of an introduction before we start. And if you haven't seen me before, this is my third live. I'm from Sudbury, Ontario, so a bit more north. And I'm currently a first year medical student here at the University of Ottawa. A bit about my past. I used to work as a sailing instructor down in Sudbury. And with this job, I had to teach a lot of environmental emergencies, the hypothermia, heat stroke, heat exhaustion, because sailing obviously involves a lot of cold and warm environments. And I thought that it would be a really important thing to talk about today because kids and teenagers do adjust more slowly than adults do to changes in temperature. And so they are more susceptible to these environmental emergencies. And so I think it's really important to get a good grasp on how to recognize them, how to treat them, and especially how to prevent them. And I thought this was especially relevant in Ottawa because, as you know, we have really warm weather in the summer and really cold weather in the winter. And this applies to all of Ontario, of course. So we definitely have to keep these environmental emergencies in mind more so than a place with milder weather. We're definitely more affected by the extremes. And yeah, so I thought it would be extremely beneficial today to talk about these ailments and how to recognize and treat them. So, just to explain a bit more about what environmental emergencies are, essentially they're illnesses that occur due to extreme temperature and prolonged exposure to these extreme temperatures. So, basically, your body has a set temperature of around 37 degrees to function. And if your body is no longer held at 37 degrees. Often, it can occur due to fever, but also can occur due to the weather outside, which is what we'll be talking about today. If we're not at that 37 degrees, our body can't function properly, our organs aren't functioning properly, and that has very catastrophic consequences. And so, cold related injuries include things like hypothermia and frostbite, and we'll be talking about just hypothermia today. And heat related injuries include things like heat exhaustion and heat stroke, which we'll both be going through today. And so, in all of these heat and cold related injuries, the main goal is to return the body temperature back to its normal range of 37 degrees. Okay, so first I'm going to focus on our cold related injuries, and I'll explain a little bit about what it is and your body's natural reactions to the cold so that we have an idea of what to recognize when we start seeing people become hypothermic. So basically, our core body temperature drops when the body loses more heat than it produces, and this is called hypothermia. And the biggest contributors to hypothermia are wind and wet. So, wind, of course, and cold air is, you know, the first thing you would think of. Like you think of being in a wintry environment, maybe you're not dressed properly, and that's like kind of the picture you think of when you think of hypothermia. But this also can be caused by wetness and water. And a lot of people don't realize this, but like as I was a sailing instructor, a lot of kids can get very cold and show signs of mild hypothermia even on a 25-degree day, because as long as you're getting hit with um, water and then hit with wind, it can be the hottest day, but they can still get really, really cold. And so you even have to look out for hypothermia, even in the summer if you're doing any water sports. It's definitely something to look out for. Okay, and so basically, now I'm going to talk about how the body like reacts to this heat loss. And so the first sign you guys can probably guess would be shivering. And that's the first sign that your body shows. that it is starting to experience heat loss. And basically, the reason why we shiver is because it's your muscles twitching. It's a muscular activity and it generates heat as a byproduct. And that makes sense, right? Because when we exercise, you get really hot, and that's because, muscular activity generates heat as a byproduct. So your body will start to shiver to try and warm up your body. And then if you get colder, then your blood vessels and your extremities, so like your limbs, your arms and legs, your fingers, your toes, and the surface of your skin, those blood vessels will constrict. And so you don't get as much blood flow anymore. And the reason why it does this is because it wants to keep your blood in your core of your body. So that's where all your vital organs are. And the reason why they do this is because they obviously want to focus all of the blood and the warmth at the organs that keep you alive. Your body's thinking, like, I don't need my fingers to survive. I need my heart, my lungs, my brain to survive. So it's a survival mechanism. And then so after the shivering and the blood vessel constriction, you'll start to experience that your body processes start getting slower. You're moving slower, you're thinking slower, your senses aren't as sharp as they were before. And then the shivering becomes really uncontrollable, like you'll really be shaking from the shivering. And then eventually the shivering will stop because the body no longer has enough strength in it to be able to continue the shivering because they're so cold. And then at this point, your muscles start to stiffen and you get a bit jerky, and then you'll have difficulty speaking as well. And then once you get cold enough at the very end, your heart rate and your breathing rate will start to slow down and you will lose consciousness, and eventually the heart stops. And so at this point, when the heart stops, you are considered dead. But when body tissues are cold, they aren't as damaged as easily from a lack of oxygen. So you actually can resuscitate a hypothermic person who doesn't show any signs of life, which is why it is really important and why time is of the essence when you are dealing with a hypothermic person, because you need to get them to warmth and medical attention as soon as possible so that you're able to, resuscitate them and that they're able to not have any long-term consequences. Um, so yeah, we've gone through the definition of hypothermia and how the body combats against heat loss. And next, I'm going to talk a bit about the high-risk populations for hypothermia. And so the first is elderly populations, and the reason is because they have poorer circulation, and so it's more difficult for the blood to be able to keep those vital organs warm. And they also have a harder time sensing the cold, so they often don't realize they're in a colder environment and they aren't able to remove themselves from that situation. There's also babies, and the reason that babies are more susceptible to hypothermia is because they actually lose heat more quickly, and they also have less control of their body temperature. Another high-risk population is adolescents, and this isn't at all a biological reason, but it's simply because they underdress for the weather. And it's unfortunate because, that can definitely be prevented, but it's definitely important to pay attention to when your teenager starts to, go out in cold weather, make sure that they're dressed properly. And then finally, high-risk populations include people who are already weakened due to other illnesses or injuries, or if they have a lack of food, fatigue, or if they have any prior alcohol or drug use at the time that they are in the cold environment. All right, so next I'm going to talk about the different stages of hypothermia specifically, and the reason why we talk about the stages is because they are treated based on what stage they're at. So with mild hypothermia, that's at the very beginning, when they first start to drop their body temperature. And so this is characterized by a normal pulse. So their heart rate is normal. Their breathing is normal as well. And they are conscious, but they're withdrawn and disinterested. So you might see them start to shiver. You might see their lips start to turn blue, or they'll complain about their fingers getting cold. And their personality might change a little bit. Again, they might seem more disinterested, but their breathing and their pulse is normal. Their consciousness is normal. Next, we have moderate hypothermia, and this is when they start to get a slower and weaker pulse, and they also have slower and shallow breathing. And so what shallow breathing is instead of like the breaths we normally take in and out, shallow breathing is like very superficial breathing. So they don't take as big breaths as they would normally do if they were healthy. So you can definitely notice that in an individual who you think might be at risk of hypothermia. They'll also be shivering a lot more violently, like I said before. As you keep getting cold, the shivering gets worse. They'll start to be more clumsy and stumbling, their muscles aren't working as well. You'll also notice that their pupils will be really dilated. So the black part of their eye will be much bigger and their skin will turn even more blue. And then finally, for severe hypothermia, they'll have their heart rate will be like weak, irregular, or even absent. Their breathing rate will slow or also be absent. At this point, the shivering has stopped and they are now unconscious. So just a quick recap with mild hypothermia, they have a normal pulse, normal breathing, and they're conscious, but they're a bit withdrawn. In moderate hypothermia, they have a slower pulse, a slower breathing, and they're starting to shiver a lot more violently and they're getting more clumsy. And then in severe hypothermia, they have a weak or absent pulse, slower absent breathing, their shivering has stopped, and they may present with unconsciousness. And so now we'll move on to treatment. So it's really important to recognize hypothermia as soon as possible to prevent it from getting worse. And this is obviously really important because the less advanced the hypothermia is, the easier it is to treat, and the less likely there will be long-term complications. And so, again, it's really important to recognize if they're in, an environment where hypothermia would be a risk. So the first thing you do when you want to treat someone is you first want to perform a scene survey, and you're looking for the two things, water and wind. And then once you think that the person might be at risk of hypothermia or is experiencing hypothermia, the second thing you want to do is take measures to prevent further heat loss. And so what the first thing you would do is you want to move them out of the cold environment. And if you can't do that, then just protect them from the wind. So if whether that be, covering them in windbreakers or covering them in a big blanket or tarp, or even getting people to huddle around the person to protect them from the wind. All those steps, are so important when trying to help an individual with hypothermia. So once you've moved them out of the cold environment or shielded them from the wind, then you want to cover exposed skin. And this is important because heat leaves through the surface of your skin. And so if you cover it, then they won't be losing as much heat. And then if they have any wet clothes, you want to replace this with dry clothes because the wet clothes, again, will suck the heat out of your body. And so replacing with dry clothes is really important to keep as much body warmth in them as possible. But if you don't have access to any dry clothes, what you can do is you can just try to press as much water out of the wet clothes and then try to wrap them in something windproof. And then finally, you want to give them warm and sweet drinks. So not super hot drinks, but something warm to help the body warm up, and sweet drinks because that has, the sugars that your body needs to start repairing itself. Okay, and so that's the general treatment for hypothermia. And basically, all those steps I explained is called passive rewarming. So passive rewarming is preventing further heat loss and letting the body rewarm itself. So if you notice that, like, we're not giving any warmth to the person, we're not like putting them in a hot bath or putting them near a fire. We are letting the body rewarm itself, and that's for mild and moderate hypothermia. So passive rewarming, everything I just taught, is for mild and moderate hypothermia. Active rewarming is adding heat to their body to warm up. So putting them in, a hot bath or putting them near a fire. This is for severe hypothermia. This can cause complications if it's not done properly and should only be done at a hospital or with healthcare professionals. And so if you do, or if you are in a situation where you have an individual who is suffering from severe hypothermia, you need to get medical help as soon as possible because it's really important to be warmed properly. It can be catastrophic if you warm them up too fast. And so, the first thing you would do is get medical help. And if you are very far from medical help, you can start the process of active warming by just putting them close to a heat source, but not very close and just a little bit. You don't want to push it because you don't really know how much heat they do need. It's the healthcare professionals that, have all of the equipment and all of the, testing they need to be able to figure out how to warm up the patient. Okay, and so we've gone through the treatment of mild and moderate hypothermia and severe hypothermia. And now I'll go through prevention. So a lot of heat radiates through your skin, so of course you need to wear warm clothing. One way that you can always mitigate being cold is always checking the temperature and the weather before you head out for the day. You can also check the weather radar, which tells you if there's any storms coming in, which is definitely helpful. I love to check the radar before I go out and do anything outside. Um, Another way that you can get hypothermia and get this heat loss is from breathing in really cold air, because this cold air comes in and needs to be warmed by the body and exhaled, which causes more heat loss. So one way that you can combat this is by wearing like a ski tube, which is like or like a neck tube around your mouth, so that the air you breathe in will be a bit warmer. Um, Another important way to reduce heat loss is to keep your skin dry, as I said before with the wet clothing, because your body heat is actually used to evaporate liquid off your skin. Your body doesn't want to have liquid on its skin, so it evaporates it. So if you keep it dry, then your body won't be working as hard to evaporate the skin. Um, and then finally, wind blows away the warm air next to your skin. So if you wear windproof clothing, with like snug cuffs around your wrists and your ankles and your collar to keep the wind out, that's a really good strategy to help prevent heat loss. Okay, so we've gone through the signs and treatment and prevention of hypothermia. And next, we are going to focus on heat-related injuries. And so heat-related injuries are from prolonged exposure to extreme heat or heavy exertion in a hot environment. And so some factors that can influence how affected you would be by heat-related injury is your age. So of course, if you're in the elderly populations or in an infant population, you are more susceptible to heat because of the poor circulation and poor ability to regulate your core body temperature. Also, your level of fitness can influence this, because if you were to, really exert yourself in a really hot day, and that's not something that your body's accustomed to, that can increase your core body temperature more than a more fit individual. And also certain medications and certain drugs can also affect this. So if you're on medications, it is something you could ask your doctor about, whether you would be more susceptible to heat-related injuries. So first, I'm going to begin talking about heat exhaustion, and then after that, we'll get to heat stroke. So essentially, heat exhaustion, what causes it is a loss of water. So you are extremely dehydrated. And basically, this affects your circulation because the blood flows away from your major organs and it pools in the blood vessels just below your skin to try and lower your temperature. So what your body does in this case is, when you have a really high body temperature, blood will go to the blood vessels underneath your skin, like in your arms, legs, anywhere in your skin, and getting the blood close to your skin allows it to let out heat out of your skin and lower your temperature. But obviously this isn't good, because you want your blood to be at your major organs so that you can continue to survive and thrive throughout your day. And so symptoms of heat exhaustion would be excessive sweating. That's your body trying to cool itself off. And you'll also see dilated pupils. You'll also experience dizziness, blurred vision, headache, or cramps. And this is all from a lack of blood flow to your brain. And so you start getting the neurological symptoms of the dizziness, the blurred vision, the headache. You can also experience signs of shock, which includes cold, clammy skin. So this is important to remember, because even though you're very hot, your skin will still be cold and clammy. And that's like a hallmark way of determining if they have heat exhaustion. They'll also have a weak and rapid pulse. So unlike hypothermia, which is a slow pulse, heat exhaustion will have a rapid pulse. They'll also have rapid, shallow breathing. So again, fast breathing rather than the slow breathing we saw in hypothermia. And they also could be vomiting or could be unconscious. You'll also find that they have a really dry mouth and they'll be very thirsty, and this is a sign of the dehydration. And they can get really painful muscle cramps, usually in their legs or their abdomen, and this is also caused by losing too much water and electrolytes from all the sweating. And finally, you can experience the individual who becomes really irritable or really aggressive behavior. All right, so treatment for heat exhaustion. So there's two routes to go on, if they're conscious or if they're unconscious. And so if they are conscious, you want to give them water or drinks with electrolytes like a Gatorade. And this is to replenish the water that they've lost from sweating. This is really important. However, if they have been vomiting, you don't want to give them anything by the mouth, and just get medical help, because they'll better be able to fix the situation. As well, you want to be able to place them at rest on their back in a cool place, really remove them from that hot environment. And if they have a lot of excessive clothing on, you can remove the excessive clothing and loosen any tight clothing that they have on so that their skin can breathe and that they won't be as hot from all the clothing they're wearing. And then you can apply cool and wet towels to the body core, around the head, and under the arms. And if they are unconscious, what you do is you place them in the recovery position, which is on their side with their arm out like this, just on their side. You can search up what the recovery position looks like and then call for medical help right away. Yeah, so we've gone through heat exhaustion, what it is, the symptoms, and the treatment. And next, we're going to go through heat stroke. And so, what heat stroke is a life-threatening condition where the body's temperature rises far above the set point of 37 degrees that we talked about. And again, this is caused by prolonged exposure in like a hot, humid environment. And basically, what happens is your body temperature control mechanisms fail. So now you're no longer sweating because your body is too hot to be able to control the body temperature, and the body temperature rises extremely rapidly. And this is really dangerous because it can cause permanent brain damage or even death. And so, symptoms of heat stroke and what to look out for is if their body temperature rises rapidly to 40 degrees or higher. And of course, not everyone has a thermometer on hand, so they are just extremely hot to touch. If you touch any part of their skin, you'll notice that it is like burning hot. You'll also find that their pulse is rapid, but continues to get weaker as they progress. Their breathing is really noisy, so they'll be really like huffing and puffing, and they sound really unwell. And as well, their skin is hot and dry. So that's one way you can differentiate it from heat exhaustion is that if you remember what I said about heat exhaustion, their skin is cold and clammy because they're sweating. In heat stroke, they're no longer sweating. So their skin is dry, it's hot, and it'll also be flushed. So they'll look really, really red. Um, they'll also complain about the same neurological symptoms of headache, dizziness, nausea. And they'll also experience vomiting, unconsciousness, and they can even experience convulsions. Um, and so, treatment for heat stroke is that lowering the body temperature is the most urgent need. So, the first thing you want to do is move them to a cool, shaded place, either inside, away from like the hot sun, or under a tree. And so you want to cool them down by removing their outer clothing. And if you can immerse them in cold water up to their chin. And if you don't have maybe like a cool bathtub available or a pool, you can also cover them with wet sheets or like a wet towel and fan the sheets to increase the cooling. And you can also sponge them with cold water. You can also place cold packs in the armpits, the neck, and the groin areas. And these are good places to target when you really need to cool the core body temperature down. So once their body finally feels cool to the touch, because if you remember, one of the signs of it being quite bad is when their skin is hot to touch. Once their body feels cool to touch again, you can cover them with a dry sheet and place them in the shock position. And so what the shock position is they're lying on their back and their legs are elevated underneath like a chair you can put them or anything that can elevate their legs up. So yeah, cover them with a dry sheet and place them in a shock position if they're conscious. If they're unconscious, put them in the recovery position, which I talked about earlier. And you can search up what the shock position and the recovery position looks like. After putting them in this position, once they've been feeling cool to the touch, you do still need to continue to constantly monitor for their temperature because if it begins to rise again, and it can, you'll have to repeat the cooling process, which again would be either putting them in cool water up to their chin, not cold, but cool water up to their chin, or covering them in the wet sheets and placing the cold packs in those targeted areas of the armpits, neck, and groin areas. Okay, and so we've gone through the signs and symptoms and treatment of heat exhaustion and heat stroke. And now I'll talk a little bit about prevention for these heat-related injuries. And so the first, of course, is dressing for the weather. And again, if you're ever going outside, it's always a good idea to check the weather, check the radar, and just see what the conditions are like for that day. You can check if there's any alerts for any extreme weather. If it's hot out, of course, wear your loose-fitting, lightweight clothing. Sunscreen is always important. That can help prevent sunburns, which increase your temperature. You can also, or you should also drink plenty of fluids, especially if you are sweating. This is really important because often people will even drink the same amount of water they would on a normal day when they're sweating, but you need to be drinking more water when you're sweating because you are losing a lot more water as you sweat. And then another way to prevent any heat-related injuries is to try to avoid the outdoors on especially hot days between 10 a.m. to 4 p.m. Those are the hours at which the sun is strongest. And of course, you can't always avoid the outdoors at that time. Like I wouldn't expect people to, always abide by those rules, but if you don't need to be outside at those really hot hours, you could definitely try to avoid it. And so in general, for both heat and cold related injuries, if you're concerned about that and you're maybe sending your kids off to like camp, you can always call the camp and we would always get calls about, what should my kid be bringing? What should they be wearing? And like they're always happy to help. Either the camp counselors, the instructors, or the camp managers have obviously experienced all of it before and they know exactly what the best thing for your kid to wear is. And so they are the best people to call because they can tell you, whether your kid needs, if they're going to be outside in the sun and they need a hat, or if it's going to be, maybe it's a cold ski trip and they need, mitts and wool socks and those kinds of things. So it's always a good idea to call in advance just to see what their opinion on what the best protective clothing is to wear to avoid any of these heat and cold related injuries. All right, so we have covered everything for today, both our cold and heat-related injuries, their symptoms, the treatment, and how to prevent them. And thank you everyone for coming. I'll read through the comments now. Yeah, my teens always refuse to wear toques and gloves, even in freezing weather. Yeah, it's definitely difficult. I definitely had a harder time dressing for the weather. I know now that I'm getting older, I'm more cognizant of it, but it is difficult to get them to wear the right clothing. But if you tell them a little bit about hypothermia and heat stroke, maybe they'll be more inclined to dress themselves properly, which is always important. If anyone has any questions, you can put it in the comment section. I'll give another minute. Okay, thank you everyone for coming today. I hope you had a good time and I hope you learned a lot, and I'll see you guys again in 2 weeks.